figure. But 29-year-old Lauren Robinson is about to pay the ultimate price for cosmetic beauty. The mother of four wanted to fix a botched breast augmentation surgery from years ago that left her scarred. She decided to go to a clinic in Matamoros, Mexico for the procedure. The town is notorious for questionable conditions and cut-rate cosmetic procedures. Lauren chronicled the entire journey, posting video of her body before the surgery. Here she is en route to Mexico. And this is a photo of her in the clinic with her husband right after the 3-hour procedure. In addition to getting her breast fixed, she got a Brazilian butt lift and liposuction. In no time flat, she appeared back to normal. Stephen Fabian spoke to her husband.
She went back to work. Everything was great.
Here she is headed to a fishing trip with her kids. But a few days after this trip, she started to feel terrible.
She just kept randomly having, like really bad migraines where she wanted to cry.
While all this was going on, Garrett, did you both have suspicions? Okay, this has to do with the surgeries in Mexico?
Yeah, that didn't take us long to realize.
What no one knew is that there was a ticking time bomb in her body. Doctors determined that Lauren had contracted fungal meningitis. It's believed she got it from either contaminated anesthesia or unsterilized equipment in Mexico.
You're putting a needle into the spinal canal. So if anything, the needle or other equipment is contaminated when you're doing that procedure, you can be introducing fungus or other contaminants into the spinal canal, and that can cause a meningitis.
Lauren suffered 4 mini strokes as her health declined and ultimately was put on a ventilator. Lauren died on May 31st, 3 months after the breast surgery. And now the CDC says 17 people have suspected meningitis after going under the knife in Mexico. A total of 212 U.S. residents are being monitored for signs of the deadly infection. Lauren's husband has a message.
Don't go to Mexico for anything like that.
Have you, by the way, researched BBLs since you've had this procedure and noticed how dangerous they are?
I have.
Have you heard of the other really bad complication you can get from BBLs?
No.
Death. It's the most fatal operation in all of plastic surgery.
Wow.
Yeah. A Brazilian butt lift or a BBL is where you take fat from one part of the body harvested through liposuction and inject it into the buttock area. The problem is the chances that that fat will get into one of those short blood vessels leading to the main blood vessel going back to your heart is elevated. And unfortunately, that can lead to a very fatal or dangerous complication.
Why have patients died from Brazilian butt lifts or BBLs? When you do that procedure, one of the things that you're doing is you're injecting fat into the buttocks, into that sort of large area of fat, large area of your gluteal muscles, your gluteus maximus, etc. If some of that fat actually gets into your big vessels, your big veins and arteries that are in that area, and you don't necessarily have to penetrate or perforate that vessel for the fat to get in there, sometimes it can be absorbed through there. It can then run through your system, get into your lungs, and create what's called a fat embolus. That can have problems with bleeding, with what's called DIC or coagulation issues. It can have problems with your normal breathing, with clotting, etc. All of which can suddenly become torrential and all of which can be life-threatening. So when doing the procedure, it's important where the fat is inserted or injected, what plane that is, how much is injected, and whether it gets absorbed in certain manner, all of which can have an effect in not only giving you the look, but can also lead to a complication that can become life-threatening.
Tragedy strikes again. 26-year-old Janisha Williams went to Florida for a BBL and liposuction and never woke up. BBL or Brazilian butt lift is when a surgeon does liposuction, gathers the fat, and transfers it to your bottom. BBL is a high-risk procedure for a fat embolism. If you look at the screen behind me, the green zone is the fat area, which is a safe zone. This is where the surgeon can safely transfer the fat. Red area is the danger zone. It's the muscle area, and it contains arteries and veins. If the cannula enters into an artery or a vein and releases fat into the circulatory system, the fat can travel to your brain brain, heart, or lungs, and most times that equals death. This is a finished result of a BBL. Ask yourself, is it worth your life? My condolences to the Williams family.
Definitely got botched on my BBL. It's been over a year.
This patient has a poor result after liposuction to her stomach. You can tell she's not a good candidate for this procedure because number one, she has stretch marks, which indicates that the skin's not going to snap back very well after surgery. And number two, she has a lot of deep fat, which is not an area that can be suctioned out. What she needs at this stage is a tummy tuck with muscle tightening. Good luck.
Please like and subscribe. For real, subscribe.